Hi everyone, my name is Ali Carlson and this is my video on my IGO and I'm doing it on the World Health Organization. So just a little bit of background information about the organization. It is headquartered in Geneva, Switzerland, and it came into force on April 7th, 1948. Their mission is to build a better and healthier future for everyone around the world. It's a fairly large organization that consists of 194 member states in 6 regions and 150 offices across these regions. They are working to combat communicable, which include diseases like the flu and other transmittable diseases, and non-communicable diseases like cancer. And they want to make sure that everyone has access to food, water, and medicine that they need to live a healthy lifestyle. So the World Health Organization directs and coordinates international health within the UN system, so it's an entity of the UN. It works alongside countries to promote healthy lifestyles and give support they need. They don't want to come in and completely take over health systems. They want the country to be there working with them because the country doesn't want, or the region doesn't want, their national or already in place health system to be interfered. And so they can't make huge, large steps because they need to be working with the country that they are partnering with. And they want to make sure that they aren't just coming in and changing everything, that everything they're doing can be implemented by the country in the future. So some of the notable accomplishments that the World Health Organization has done includes eradicating smallpox. It's the only infectious disease to ever be completely eradicated, and that was after the World Health Organization led a global immunization campaign to immunize regions that were affected by smallpox and to completely eradicate the disease. But speaking of immunizations, they have provided vaccines to millions of children all over the world and have prevented these children from dying from diseases because they're able to get their vaccines. For tuberculosis, they have saved 53 million lives since 2000 through the prevention, diagnosis, and treatment, because with their work, they've been able to help people who would not have known that they had tuberculosis or been able to get the treatment they needed for it, and so they're able to save all these lives. They also helped save a lot of lives through providing mosquito nets and treatment and prevention for malaria. Deaths have dropped about 60%, so that's a large increase of these deaths that are very obviously avoidable, but they just need the resources, and the World Health Organization is there to provide these resources for them. Another thing is HIV. They've helped 21 million people get life-saving treatment after they've been diagnosed with HIV. They also are working closely with countries affected with Ebola. And here in 2019, there are some confirmed cases of Ebola in the Democratic Republic of Congo. So they have been working with these people to help them be treated and get the support and medicine that they need. They also are providing vaccines and treatment to those in areas that might be afflicted by Ebola. And they also, one thing that's great about them is they put out health advisories of where you should and shouldn't travel for people who are looking for places to go. And so they have a strong travel advisory against traveling to the Democratic Republic of Congo because of this Ebola outbreak right there. So the strengths of this organization include improving the lives of millions of people across the world by providing the basic healthcare needs that they can't get. They implement very practical measures. They just set up clinics, they train workers, and they're vaccinating people. But this is in countries that don't have the resources. These are smaller countries that don't have an industrialized system that's already in place for their healthcare. So these often a lot of third world countries. And they represent the interests of these poorer third world countries because a lot of them don't have the ability to speak up for themselves to get the fair access that they need to pharmaceutical drugs and vaccines that other larger countries already have access to. When they're on the progress of making health for all and helping people all around the world to get the health care that they need. But like big organizations, their bureaucracy does exist within it. China did put some political pressure on the World Health Organization to block Taiwan from participating in the assembly, and they did block them. And the U.S. strongly urged that the World Health Organization should allow the Taiwanese reporters to be at the General Assembly and to take part in the mission. They also spend over $200 million a year on travel expenses. This money could be better served helping people in these countries. Their travel costs are more than what they spend on mental health, AIDS, tuberculosis, and malaria combined. And so they're trying to get things that and travel around the world and get people things that they need. However, I believe that they could cut these travel costs down and help people more. So I selected this because I've always used information from the World Health Organization for research papers in different classes and stuff. They have such a large database of country profiles, things that's going on around the world, and it's just like an amazing source for all this information that you can get. I've also been interested in working abroad, and this would be a great organization that I think to work for. I have interest in the medical field. I am studying chemical engineering, and I was thinking about going pre-med, but I decided that I want to do more laboratory work type of stuff. And my dream job, I guess, would be to create vaccines and different medicines in like kind of the background side of medicine instead of the upfront. And so I could partner with different corporations that work with the World Health Organization to develop and provide these vaccines around the world. It would also be a great experience to just go and travel and see these countries and see the people who are being helped and administer some vaccines to people. I think that the World Health Organization is a great organization that is providing help to people around the world who don't have the healthcare that they need. And with their strides forward, they're going to continue to help people and provide the medicine to everyone. So thank you for listening.